Hello there, Miss Blight. This is our group. My name's Kellen. We also have Rachel Riesel here and Chang Nemitz as well. Our project this is our delegation clinical project, and it's over early hand expression. So what we're going to be doing is going over it as a team and reading each part and talking our way through it, discussing it, and basically showing why this would be a good educational handout and how it demonstrates proper delegation. Okay, so would y'all guys like me to read the first part?
Sure. Yes.
Wonderful. So, Early Hand Expression Project. What is the Early Hand Expression Project? Our staff should be well equipped and have the tools to teach our patients the importance of early hand expression within the first few days. So basically, this is talking about the technique that's involved during the first few days of breastfeeding and lactating, and basically, it shows the benefit of the colostrum and how it's real important that we make sure that that takes place properly with this technique. So, whoever's next.
Okay, so it talks about why are we doing this project? The next paragraph talks about it says colostrum protects the gut and boosts the immune system of the infant. Inadequate breast milk intake can lead to problems such as excessive weight loss, jaundice, rehospitalization, low blood sugar, etc. We are caring for many mothers who have risk factors that can affect or delay lactogenesis too, and the infants who are late preterm or had birth trauma, not yet developed good sucking skills to remove colostrum effectively. As a result, low milk production leads to early supplementation, causing many mothers to stop breastfeeding early. Early hand expression is proven to boost a mother's milk production. According to Dr. Morton, expressing colostrum within the first hour can increase milk production by 130% at 6 weeks. The more out in the beginning, the more milk in later. This project hopes to help mothers who have the desire to breastfeed their infants build a good milk supply, have a longer breastfeeding duration, protect mother and baby and dad's health, and increase the breastfeeding exclusivity rate.
Perfect,
Yes.
perfect.
So that's just
And
like the good education regarding why it's important and who's going to be involved with it.
mhm. So what are our current data and how do we measure the success? So pretty much is the manager will look at the exclusive breastfeeding rate for the last 3 months before the intervention phase and monitor exclusive breastfeeding rate for 3 months after the intervention phase. So we will get the feedback also from the nurses who are actually directly doing this project. Um, before and after the intervention phase.
Perfect, perfect. And that brings us into what the interventions we are implementing will be. So, first one is within 1 hour after birth, the L&D nurse or whoever catches the baby explains and teaches the mom how to do the hand expression technique correctly. Two, the mom is encouraged to practice hand expression throughout the hospital stay. Three, the postpartum nurse who cares for mother and the baby's dad, continues to remind, review, and assist mom with hand expression. So I guess an important part of delegation would be is to as well as to delegate to the father to help with the process as well. So you'll delegate the task to the mother, but also the father to assist as well. So I guess that brings us to when we will start the intervention phase.
So when will we start the intervention phase? Phase one, December 1st, for all the nurses to review the video and information. Keep a lookout for bathroom posters to learn more about hand expression. Phase two would be December 15th, so a couple weeks later, preparing the supplies, collect exclusively breastfeeding rate of September, October, and November. Different volunteers, techs, and breastfeeding coordinators can help put the kits together. The labor and delivery, antepartum, and postpartum nurses should keep one bag of hand expression kits to teach each patient how to express and collect the colostrum. And hand expression kits should be counted, then distributed in all supply rooms on the 7th, ninth, and 10th floor. And then on January 1st, we'll implement the intervention, teaching our patients to hand express within the first hour and continuing throughout the hospital stay. So during the whole intervention phase, there's many different people that are involved that are going to be delegated different tasks to help put the kids together, to review the videos regarding the education, um, and then make sure that all of the kits and everything are distributed through the different units.
I absolutely agree, and I think that it was a good point that Trang made on this one input that she put was for the volunteers, techs, and the breastfeeding coordinators to put the kits together. I think it's important because that task follows all five rights of delegation, and because it's appropriate for that person to complete that task safely, it's within their scope, it's for the right reasons, and it can be monitored and evaluated adequately. So that was good. And what else do y'all think?
I,
Also, yeah, just to add on to that, I think it's good that the labor and delivery nurses, they all need to be working together. And as long as they're on board with it, it should be really beneficial to the mother and the baby as well, but the unit too, just the whole educational aspect of it. And just, I think it's important to make sure that the correct tasks are delegated to the appropriate employees. And I think in this case, it most definitely is.
I think especially in most hospitals, and I don't know about Trang's hospital, but a lot of hospitals wait for, a significant amount of time sometimes to be able to see, for the mother to be able to see the lactation nurse because there's maybe only one per unit. And so
Mhm.
to have other people that are trained and educated on how to assist that mother for the very first time, and also to educate the father is really important because especially like at the beginning where it says that it's a crucial time, especially when women that may not be able to, do it on their own to get that first set of milk, especially if the baby's having difficulty, then they get frustrated and then they may not breastfeed. So to encourage that mom to be able to do it, and while waiting for a lactation nurse to arrive, other people can be involved and assist with that task as well.
I couldn't agree more. I think that's wonderful.
Yeah, I think it's like you point into the most important point. Is that's the reason why these projects come out, and everybody will have some kind of responsibility, from the text from the coordinator who is not actually is like see mom at the first in the first time the first few hours. So most of the time it's like a nan or like a baby catcher or labor and delivery nurse who actually is like have some set of trainings are more confident in that they can also do it so it's not waiting for the lactation to come because most of the hospital nowadays as my understanding is that the lactation is not coming to see the mom within the first 12 hours so
Mm,
that's why it's super important for everyone like labor and delivery nurse a nan and the postpartum nurse be able to show mom on that way because a lot of times the baby very sleepy could be because of the delivery C-section or trauma birth they're not gonna eat that much and then so with knowing how to do hand expression and help her supply but also help preventing the baby losing weight or the blood sugar is going low and then to prevent like unnecessary supplementation. So this project is like throughout the whole unit,
right.
everybody united and learning. So it's not just point out only a job of one person.
Right.
Absolutely. Absolutely. One last thing I'd like to point out is that I think this is going to be a very effective project. Not only because it what's it called? It acknowledges appropriate delegation practices, but it also it is a great good SMART goal because if you go down the list, it is specific, it's measurable, it's attainable, it's it's what's the R again? It's well, it's in a good time frame as well because you're able to measure all those things. So yeah, I couldn't think of a better project to do. So y'all guys agree?
Yes.
Wonderful, wonderful. Let me see if I can go back to our video. Okay, cool. So do y'all guys have any closing thoughts or concerns or any final closing words?
Mm-mm. I don't have any concern.
Wonderful, wonderful. Well, I've enjoyed working with y'all guys and I appreciate y'all's time. I'll be sure to capture this recording and submit this to Mrs. Blight.
Thank you so much.
Thanks,
You're
Kellen.
welcome. You're welcome. Okay, stopping. Let me make sure the recording stops.